Live on 2GB, 2CC and stations across Australia, it's The Chris Smith Show.
G'day. Welcome to Saturday morning on the radio. It is a beautiful day out there. Beautiful. Lockdown or no lockdown. Spectacular. I'll get to the forecast shortly. But a stack of great information and entertainment coming your way today. From the very latest COVID numbers, of course, live cross to the New South Wales press conference at 11. And a terrible mistake by the New South Wales Crisis Cabinet late yesterday. Can't believe this. I'll get to that shortly. To everything you need to know on real estate trends and finance. It is a big program ahead. But first, let's get you to some of the basics and, of course, our weather forecasts. Firstly, from Victoria, just through, as you may have heard in the news, Victoria has recorded another 21 locally acquired cases. They haven't imported any from overseas, but they've got 21 locals. And the most important aspect of that number is the fact that 10 were in the community during that period whilst infected. 10 in the community. Now, these just keep mounting up for Victoria. They're nowhere near as bad as New South Wales, but they are mounting up. And the caseloads for every single person who was out into the community mean that contact tracers have a stack of work to do. This is from 33,675 tests as well. 33,675. That's Victoria. Now, in terms of New South Wales, there is a new list of venues that people need to know about, especially in terms of COVID. There was a COVID case that visited Trim's Fresh at Merrylands in McFarlane Street on Friday between 11:05 and 11:15 in the morning. Now, you've got to immediately get tested if you were there during that period and isolate until receiving further advice from New South Wales Health. Also, Aldi at St Mary's on last Sunday, 2:30pm to 6:30, and also last Monday, 7am until 1pm. Same thing. Get tested and you'll get a call from New South Wales Health. Jarrad's Pest Control Supply in Seven Hills. If you were there on Sunday last, between 8am and 5pm, Monday last, 8am until 5pm, and Tuesday between 8am and 5pm, the same. And Jesmond, the Thai eatery at Jesmond in Blue Gum Road, Monday, 5:30pm to 6pm. Now, a list of venues too, about 7. I'll only list the venues that are in Sydney because there are a number of venues in Dubbo, for instance, that won't be of much interest to people listening through 2GB. But if you're you'll be deemed to be a close contact if you were at these venues during the allocated times. You must get tested, isolate for 14 days, regardless of the result. So Jesmond, Priceline Pharmacy, 12:50pm to 12:55pm. Strathfield, the Hadjingook Restaurant, last Sunday, 7:30am until 10pm, and last Monday, 7:30am until 10pm, so that's obviously a staff member. In Ultimo, TAFE, Building D in Harris Street, last Monday, 4:30am until 12:30pm, and last Tuesday, 4:30am until 12:30pm. And then the other venues are purely in regional New South Wales. There's some concerns about the positive results coming through from the sewage surveillance program. These have been really indicative and have led to clusters. They're really helpful to those who are trying to trace where COVID has moved to. Tamworth sewage system has shown up as COVID fragments, as they deem it. The Bomaderry sewage treatment plant, Bathurst and Parkes. So that's the latest from New South Wales Health. In terms of tomorrow, it is Super Sunday at Sydney Olympic Park Vaccination Hub And 5,000 appointments available for the AstraZeneca vaccination. This is not a walk-in clinic. You need to go to the website and you can book and you can turn up there. So a big day, Super Sunday, they call it. And also a lot of tradies going in on the weekend to get their jabs as well. In terms of vaccinations, you heard what the Prime Minister said late yesterday, 15 million so far in Australia. In terms of international vaccination, it's hit 4.6 billion. 4.6 billion. So they're the vaccination updates for you. Weather-wise, sunny today, top of 21, the same for Sunday, so a great weekend planned. Monday, sunny 21, and Tuesday, mostly sunny, 18 degrees. So 3 fantastic weather days. In Perth today, sunny 20, Adelaide sunny 17, Melbourne mostly sunny 18, Hobart partly cloudy 15, Canberra sunny 16 degrees, in Brisbane a shower or two and 23 degrees. We will be talking with Dennis Shanahan very shortly from The Australian, stacked to talk about not only what's happening in terms of those Afghan helpers, those who were left behind by Allied forces. There seems to be a major operation underway between the Brits, the Americans and the Australians to go and, rescue those Afghan helpers from the clutches of the Taliban before the Taliban take over those key cities. And we'll talk about that with Dennis. National Cabinet yesterday, there's some anger from other parts of Australia towards New South Wales and Gladys Berejiklian. We'll talk about the vaccination milestone of 15 million, the outlook for the economy as well, and those climate change targets are back on the agenda. We'll catch up with Christian Jansen and talk sport. Dr. Jamal Rifi from Southwest Sydney will be on the program today. I want to gauge what he thinks are the problems involving compliance. He's pretty switched on. He's got his finger on the pulse, Jamal, both literally and symbolically, but also vaccinations. There was a time when Jamal, who was dishing out vaccinations, couldn't find anyone to take AZ. I just wonder whether that's still the case or has that changed. It might be interesting to find that out as well. Ask a Tradie with Simon Stevenson, of course. We'll also catch up with Jim Haynes. Part 2 of Radio Days and how our Aussie humour developed through radio. Great prizes in the rolling quiz and the track of the day, and that's just the start of it. We'll get to as many of your open line calls as we possibly can as well. 131 873. Off we go. You're with Chris Smith, broadcasting live from 2GB in Sydney. Well, so much for this new tranche of stricter health orders in New South Wales. 24 hours after I heard the Premier say that the Police Commissioner's wish list would be granted, Gladys Berejiklian has reportedly stopped one of his key demands. Can you believe that with 390 daily infections, probably over 400 by 11 o'clock, and a drastic lack of compliance out there, the government refuses to get tough? And this is one of the reasons why most other states and territories are angry with Gladys Berejiklian, because she could go further. We're dealing with a very different virus at the moment. What has leaked to the Herald today is that fines for breaching health orders have rocketed to $5,000, up from $1,000, which is great. So all those entitled and selfish COVIDiots, you deserve it. So get whacked with $5,000. I'm looking forward to that. But a request to prevent everyone in Metro Sydney from travelling more than 5 kilometres for exercise has been refused. Now, I don't care where you live. You can exercise within 5 kilometres. Anything else is just an excuse. So the New South Wales government decides, no, we couldn't do that to people in Sydney. What a terrible, gutless decision this is from the New South Wales government. You see, police are confronting those who refuse to stay at home every day. And in almost every case, as I've been told by officers on the ground, those who are on the other side of the city claim, oh, we're just exercising, man. Look, I've got my runners on. It is the standard reply police are copying. And it's just an excuse to ensure they can go anywhere all day to see their mates, get around the city and escape a fine. So the Commissioner, Mick Fuller, He's worked out how to beat these COVIDiots. If you're out of your 5K radius, you're done. $5,000, thank you very much. A brilliant but simple rule to stop mobility, which we're told by the top health expert working for government is the key to driving down these infection rates. And what did the crisis cabinet do yesterday afternoon? They chickened out. They allowed the non-compliance to continue unabated, which it will. Grossly disappointing. I think the Premier has failed again. She failed in the early stages to lock down parts of eastern Sydney because she was dealing with a different virus. And she's failed again. This is significant. The cops had nailed their health orders, but the politicians, with all their inexperience, thought they knew best. Meanwhile, a Premier who overreacted repeatedly prior to Delta, WA's Mark McGowan, I think he's come up with a masterstroke. McGowan has ruled that anyone who wishes to travel from New South Wales to WA must have at least one jab. This is exactly what National Cabinet should adopt as well. Reduce the risk by incorporating a rule which leads to a drastic reduction in transmission, as every epidemiologist I've spoken to says. Simple. As I've said 1,000 times, this is the rule which should now apply to all international returning travellers. I just said that 4.6 billion people around the world have been jabbed. So it's not a big ask to say to them, well, the likelihood is you've got the vaccination so you can come back to Australia. But no, we don't do that. We just import the virus. No jabs, no fly. Stay right where you are is what we should be doing. But no, just like New South Wales, the feds don't have the guts to adopt the tougher measures which will plug the gaps. We're not dealing with the old COVID anymore, where you could isolate and contact trace your way to zero, where lockdowns were an overreaction and we all hated them. It's different. This is Delta. All the places we simply cannot close are key sites for transmission: hospitals, supermarkets, pharmacies and GP clinics. I always thought if the enemy was tougher, you had to get tougher in order to beat that new enemy. Well, in the cases of Gladys Berejiklian and Scott Morrison, the penny still hasn't dropped. "19 after 9. This is Chris Smith on the weekend. The usual COVIDiots have sent me a few text messages. The injections don't stop the spread. Have 57 of them, please, says Mike. Mike, I don't want you to listen to anyone in government. I don't want you to listen to anyone in medicine in government. Go and listen to the eminent independent epidemiologists who overwhelmingly say you can reduce transmission. You can reduce your likelihood of death and serious illness by getting the vaccine, Mike. It's not a conspiracy, mate. I'm sorry to let you down. One here from another listener who says, unfortunately, Gladys has now become part of the problem. Part of the problem. It would be very interesting to find out how many pollies live in the eastern suburbs, writes Greg. I guess he's intimating there that's one of the reasons why we didn't lock down earlier when a lot of people were calling for it. 131873 is the telephone number. Chris, you'd be happy to let plane loads of fully vaccinated people come from, say, Israel, where they now know Delta is not stopped by vaccines? Adam, that's not the information coming out of Israel. As a matter of fact, if you go to the United States, you can look at just about every state, and 94 to 98% of people in a hospital have not been vaccinated. They're the facts. I'm sorry to tell you, I'm sorry to let down the conspiracy theory, but you're wrong. And that's why we're calling on people to get vaccinated. It is that simple. 25 after 9.
Prime Minister.
The Labor Party
Stepped over the...
There'll be silence.
And now, politics with Dennis Shanahan.
Time to dissect another week in politics with the one and only Dennis Shanahan, national editor of The Australian, who's now in lockdown. Join the club, Dennis.
G'day, Chris. It was inevitable that Canberra would be locked down. We are an island in the middle of New South Wales.
Yes, very, very true. Interesting, isn't it, that you've got students impacted here, and the same has applied in Queensland and New South Wales, where we're seeing a lot of younger people contract the virus, which has got to be a worry to those who've got to work out how to stop mobility?
This is particularly a worry, the way that the Delta virus variant actually affects younger people. We've seen a lot of deaths of younger people who have been unvaccinated. And in the ACT, the initial source of the outbreak was identified. There have been 4 members of his family, close contacts, who are also the other cases. But the real concern is a young teenager who came from a school at Gold Creek, and they don't know where that student was infected, and hundreds of people are now classed as close contacts. So the ACT is facing a bit of a problem here, but of course, compared to what's happening in New South Wales, it is still under control, but we've just got to wait and see. And the ACT government has enforced a lockdown and, minimum travel. All of those things are in place in the ACT. And I think that the ACT has demonstrated so far that people who live there tend to be observe the rules. They've gone along for vaccinations. They are very well behaved as far as social distancing is concerned. We've had very few outbreaks of, if any, of complaints about all of that. So that's the hopeful outlook for the ACT.
So what's the parliamentary outlook? Because the headlines were, once this lockdown was tipped, that politicians were racing out of Canberra. Where does that leave the next sitting week?
Well, a number of politicians left Canberra as soon as it was clear that the word was getting out that there was going to be a lockdown in Canberra. In fact, a lot of people had been expecting a lockdown earlier in the week. The sort of word was out. My local liquor outlet is always a very good indicator as to when there's going to be a lockdown or more restrictions. And so when the MPs actually heard it, they had till 5 o'clock to get out of Canberra and land, for those going to Queensland, to land in Queensland before 5 p.m. So a number of Labor and LNP MPs flew to the Gold Coast and landed there before 5 o'clock so that they could return to their families. Now, what impact that will have, there were some that went to Western Australia as well, what impact that'll have on the sitting of Parliament. At this stage, the Speaker is of the view that Parliament will sit. It will just sit with even fewer people in it because those who have gone away, of course, now can't come back. And next week is a non-sitting week. It is the break in the middle of August, but then there is a scheduled 2-week sitting after that. Now, there have been discussions that whether that 2-week sitting should be just cancelled or reduced, cut back to a week. But at this stage, the schedule is that Parliament will be sitting under the same conditions, even stricter conditions than it was last week, and that it will continue. But all of this is open to change, and of course a number of MPs were already in lockdown and not in Canberra.
I'd love to have been listening in on that National Cabinet hookup yesterday, because I get the feeling there's a great deal of tension towards the way New South Wales and the Premier are handling this outbreak at the moment on behalf of those in other jurisdictions.
Yes, look, the National Cabinet has been fairly tight about what's actually said in there, but I think it's pretty clear for those talking to people connected to the National Cabinet and what some of the premiers have said after the meeting, that there is a great deal of criticism of Gladys Berejiklian for not locking down harder and faster. And I think that's accepted by everyone now. But my understanding is that the other leaders, federal, state and territory, are now of the view that New South Wales is going to get worse, that there will be more than 400 cases, perhaps as early as today, and that will continue. And yesterday, the Premier of Western Australia, Mark McGowan, said he thought it could go to 500 cases a day. Now, if that's the case, Western Australia will declare an even harder border against New South Wales, and of course New South Wales will be blocked from just about everywhere else. So there is a great deal of tension directed towards New South Wales, and the irony is that in the days of the Spanish flu, there was a great deal of tension because Victoria didn't tell the other states that it had Spanish flu present, and it popped up in New South Wales. So this is a long history of state differences and blame shifting between the states.
Yeah. We'll take a break and we'll come back, talk about some of these vaccination rates and also Afghanistan and this plan or operation in place by Allied forces to basically rescue Afghan helpers who are left in places like Kabul. We'll talk with Dennis Shanahan further right after this break. It is 28 minutes to 10. 25 to 10, 15 million jabs. Quite a milestone, Dennis Shanahan, and 1 in 4 have been fully vaccinated.
Yes, indeed. The vaccination rate is ramping up quite considerably. If it keeps at this trajectory, we should be able to reach the Doherty Institute target of 70% vaccination before the end of the year, which should be able to enable our leaders to have fewer lockdowns, fewer restrictions. The acceleration, of course, has been boosted by fears of the Delta variant outbreak in New South Wales and now everywhere. There has been a re-release or a revival of the AstraZeneca vaccination. And interesting, Daniel Andrews, the Victorian Premier, has been pushing vaccination very hard, and he is actually looking at getting 1 million jabs in the next few weeks in Victoria. And that includes hubs, including AstraZeneca for younger people. So, look, I think there has been a change in the pace of vaccination, notably a pace. Greg Hunt has stopped talking about just bald numbers in Parliament about vaccination, and now he's talking about, he said last week there was the equivalent of the entire population of Adelaide vaccinated. He's trying to give people an idea of just the number of people who are being vaccinated to try and encourage those who aren't to do so, because as you were saying earlier, there is no doubt that, as the Chief Health Officer has said previously, this is a pandemic now of the unvaccinated. And all of those who have, been hit in New South Wales, with the exception of one elderly man, have been unvaccinated, all the deaths. And so vaccination can help reduce that impact. And Scott Morrison is still, though, maintaining that he will not have mandatory vaccination in Australia. There's obviously, a large part of the population, estimated between 10 and 20%, who are concerned about vaccination, who are hesitant about it. And the Prime Minister is saying that it's not the Australian way to force people into vaccination, and that includes people who may have to, he's not providing a legal framework to support the idea of no jab, no job, because what he's trying to do is get people to volunteer for their vaccinations so that we can, and we should be able to get to the 70% level just with the interest and the self-interest of people going to do it. Same thing's happening in New Zealand. Very low death rates, very low infection rates for all the time. New Zealand, along with Australia, two of the best performers in the world. Also, two of the slowest on vaccine rollout for that very reason. So that's changing now, and they're under pressure in New Zealand to increase their vaccination rate.
Just on the question of things that are mandatory and whether we should be mandatory, and I don't agree we should be making this vaccination rollout mandatory. I think that the Prime Minister is on the right side of this argument. But I get so many letters and emails from listeners who want this thing mandatory. Richard sent me a note only this morning. He says, this is my 2 cents worth. There's nothing new, excuse me, in things being mandatory. For example, it's mandatory to have a driver's licence to drive a car. It's mandatory to drive on the left-hand side of the road. It's mandatory to wear a seatbelt in a car. It's mandatory to vote. It was mandatory in the 50s and 60s too to have a chest x-ray to prevent the spread of TB. It's mandatory to have a hepatitis vaccination to work in a hospital. So now's the time to make COVID vaccinations mandatory. I don't think that would go down at all well with the public, even the majority of those who are getting vaccinations, Dennis.
I think that's right, Chris. The danger is that a mandatory judgment would only confirm all of those, or the group who are anti-vaxxers, who believe in conspiracy theories and world government domination and all this nonsense. If they see a mandatory judgment coming from the federal government, they will entrench their views, and it will spread their views to people who may in fact already be vaccinated, but against the idea of government intervention. So I think that, but having said that, and the listener has a point there, that there are a whole range of other things where there are mandatory requirements. Yep. And there is an increasing view that we can sort of creep towards this in areas where it's necessary. Aged care workers is, of course, the primary idea. One of the reasons that the death rate in New South Wales is lower than it could be was the fact that the aged care centres have been almost fully vaccinated. But the aged care workers are not. Part of the pressure on that is that people, the unions, the employers, and people in government are afraid that if you make something mandatory, although aged care workers are going to be, because by the end of September, because it is such a danger to the aged care residents, that you then, if they run the risk, if they have a side effect, then they can sue. And this is why employers are taking a risk when they say, oh, well, you have to have a jab to work here. And now, if it's in a hospital or something, it seems reasonable. But if it's somewhere else, then they're taking a big legal risk. Now, the government's trying to provide what encouragement it can to these campaigns, but to legislate, and, of course, the state governments can put in public health orders. This is another issue. They can put in a public health order, as they do for flu or various other hepatitis and other things, and that can make it enforceable. So in certain areas. Now, we've seen in Western Australia, again, Mark McGowan, the man of the hard lockdown, is saying that people travelling from New South Wales now have to prove they are vaccinated to get off the plane. Yeah. Now, this is a step towards a green pass, a vaccination pass, and this is for domestic travel, not international travel.
Yeah, interesting. And what is also interesting is what's happening in Afghanistan. The Taliban have claimed about half of Afghanistan's 34 provincial capitals. That you could say 2/3 of the country already. There are early signs of the group's repressive rule on display in some areas, looting and parades on the street of those that they're targeting already. And the UN says more than 1,000 civilians had been killed in the past month. And what we're hearing is that the US, teaming up with the Brits and even the Australians, are heading back into Afghanistan to try and save the Afghan helpers, who, of course, would be the first targets as soon as the Taliban take over those major capitals like Kabul.
Yes, well, this has been a bungle from the beginning. That is the end of the war in Afghanistan. Declaring a date on which the US would pull out just gave the Taliban carte blanche. They knew that there was a deadline, that the US had to meet that deadline, and that they'd be pulling out no matter what. So the idea of doing a deal with the Taliban was redundant. The Taliban went through various exercises of appearing to discuss peace and cooperation and shared government while launching a massive offensive across Afghanistan. Yeah. As a result, cities are falling night by night, and what's happening is areas like Tarin Kowt, where Australians were based, are being overrun. We've seen Afghan soldiers shot and dragged through the streets in Afghanistan. We know that women are being stopped from doing various things, that they're forcing marriages and stopping girls going from schools already. So this is obviously a disaster of a withdrawal. And what Australian government is doing is trying to get Australians who are there out, but also trying to get out as many as they can of Afghans who have applied, and now the criteria seem to be pretty tight. But the Defence Minister, the Prime Minister, Foreign Minister are all saying that they are working to get these people out. A number of visas have been allocated. There's about 50 outstanding that haven't been processed yet, and they're trying to get those processed and then out of the country. Now, obviously, at a time like this, you don't talk about the logistics of how people are coming out, but the Prime Minister has indicated that Australian ADF facilities, obviously planes and so forth, could be used to get people out in coordination and cooperation with the US forces who are still there.
Okay, I'll let you go. You enjoy your weekend, Dennis, and thank you so much for that
Chris.
Incredible wrap-up. Thank you, mate. Dennis Shanahan from The Australian.
And now, a sports update.
I'll get to your calls as soon as I possibly can. Straight after an ad break, I'll get to your calls. 131873. Plenty of people want to have something to say. Christian Jansen, what did you make of the Panthers last night?
Good morning, Chris. I just feel like with Nathan Cleary back, they're just ready to build some momentum ahead of the finals again. They lost it when he was gone after that shoulder injury.
Time.
I just wonder if that shoulder charge he did last night, whether he'll come under some scrutiny today. It wasn't penalised. In fact, it was given a try.
It was a shoulder charge for all money.
He might be in a little bit of trouble. So just when they get him back, they won 34-16 over the Dragons, put a line through them. The Roosters-Broncos game was a thriller. We weren't expecting that. Roosters getting home 21-20. That was an Adam Kieran penalty goal. He's got ice running through his veins, that kid. Can kick.
Yeah. What a crazy last 8 minutes.
Well, the lead changed 3 times. It was a field goal from Albert Kelly, got charged down. Then it was a penalty goal to the Broncos. You thought they were going to get it. They've been unlucky there last night. 3 games today. The Rabbitohs against the Titans. Dane Gaggai's out for your mob. The Cowboys against the Tigers. North Queensland's lost 8 in a row. And then this is the good one. Manly versus Parramatta.
That'll be a good game, that one.
Battle for the top 4 there.
Yeah. GWS Giants got over Richmond. Yeah, everyone gets over Richmond nowadays.
Yeah, they won't make the finals. No. 39-point win for the Giants. Tim Taranto, 4 goals. Josh Kelly celebrating his new 8-year, $1 million a year contract with 32 touches. The Swannies play North today.
Okay, look forward to that. Thank you, Christian.
Thank you, mate.
Christian Jansen with the Sports Update. It is 13 to 10 to your calls right after this. Let's go to the gong. Mick, good morning to you.
Good morning, Chris. You're talking some sense there, mate. Because I tell you what, Gladys Berejiklian got lucky with the first round, as did ScoMo. But every time that a new strain of a virus comes out, the next big thing, it is always more virulent and sometimes more lethal. Otherwise, it doesn't become the next big thing.
Yeah, she's dealing with something very different this time round.
But I tell you now, she poo-pooed McGowan and them for quick lockdowns all through out of it. Turns out they were right, and we were just lucky because we are in a whole mess of trouble now, mate. And I tell you something, vaccines, I've had both jabs of AstraZeneca.
Good on you.
That does not protect. It's not like the measles vaccine where you get herd immunity. It doesn't protect the people who are unvaccinated.
Nope.
We have 80% vaccinated. We can still pass it on. We can still get it and pass it on. So they're not protected. My mate's a GP in England. He said they're getting 25,000 cases a week and no one says a word about it. Why? Because they're 80% vaccinated or whatever. He said the only people in hospital are unvaccinated, and the first thing they're screaming out for when they get real sick is the vaccine.
Yeah, I bet they are. They are, Mick. Good on you. Well done for getting vaccinated too. Joseph in Marsden Park. Hi, Joe.
Oh, g'day, Chris. Good to speak with you. Good to hear the latest. But look, I'm not normally a fan of Mark McGowan, Western Australian Premier, but a good move on him to introduce vaccine passports to his states. Essentially, good move to encourage vaccination.
Yes, that's the other thing. You see, if every state and territory did the same as McGowan did now on getting entry to their state or territory, it would improve the vaccination rate.
Absolutely, it would have that effect. I mean, and you were talking before about mandatory vaccinations, and there's a case for it and against. But let's be frank here. There's another issue here. They at the drop of a hat, they close your business, they close your livelihood, they lock your work. It's a double standard. Yep. We need that mandatory vaccination happening or some encouragement on a legal platform.
Yeah, good on you, Joe. Thank you very much for your comments. Irene from Castle Crag writes, your opening comments today on Gladys and ScoMo are spot on. Gladys is wrong in not toughening up on enforcement, and ScoMo is not showing leadership and not supporting mandatory vaccination for employers, as are the unions. Thank you for your stance on this. I've got another email saying a similar thing. Just on this 5 kilometre rule, though, wouldn't it be instantly obvious to the crisis cabinet that was the way to go? Mick Fuller worked it out. His coppers have been catching people who are a long way away from where people are living, and they're saying to people, I'm exercising. Well, they're allowed to exercise. And this stymies police trying to enforce compliance. It would have been the number one thing to do, apart from increasing fines to $5,000, which is a good thing. I noticed that Ray Hadley rang in late last night to the continuous call team to say that Gladys has now turned around and agreed with the 5 kilometre rule. Well, I hope he's right. Both the Telegraph and the Herald are saying that she hasn't agreed to this. Well, we'll find out at 11 o'clock. I hope she's changed her mind. I hope he's right, because it's an obvious thing to do. Patricia in Sans Souci. Hi, Pat.
Good morning. I'm just so angry about the compliance, the meeting yesterday, the crisis cabinet with poor Mick Fuller. He's the one you've got to feel sorry for, dealing with Gladys. She you've got to give her. It's not been an easy job, but I walk down every day. I'm close enough to Botany Bay and walk along from down to Ramsgate and back, which I have my mask. I've been doubly vaccinated.
And I bet all those people on that walkway where you live are from a long, long way away in southwest Sydney.
Oh, that's what I want to tell you, because the elderly gentleman, he said, hello, how are you? I said, I'm well, thanks, and yourself? I've got my mask on. He doesn't have his mask on.
And where was he from?
So just Punch Bowl.
Oh, there you go, Patricia. It's a no-brainer. And I do hope Gladys Berejiklian has changed her mind. I understand that the Commissioner and the Premier are meeting sometime this morning. Well, hopefully it's to change her mind if she hasn't done so already, because it's an obvious no-brainer to ensure compliance, and compliance is the thing that we're not getting right. A busy hour ahead of us. I'll get to Dr. Jamal Rifi in southwestern Sydney to gauge compliance issues, some of these new rules we're hearing about today, and vaccination rates. He's got his finger on the pulse on all of that. And Simon Stevenson is in. Ask a Tradie, a chance for you to ask questions about home improvements.
You're listening to The Chris Smith Show on 2GB, 2CC and stations across Australia.
So good to have you with us. Plenty of information and entertainment to come, including that 11 o'clock press conference. Let's just keep our fingers crossed that Gladys has changed her mind, as was reported late last night here, and she's understood exactly what Mick Fuller is trying to do. This is the way you stop people travelling 10 Ks and claiming it's for exercise. And I'm sure people are travelling 9, 10 Ks for exercise. But you don't need to. You don't need to. You can easily exercise within a 5 kilometre radius. If we've got to stop mobility, which takes the virus from point A to point B, put in that rule. We'll find out in less than an hour's time whether she's seen the light. Jenny from Carringbar, what you said was 110% correct. Jabs before entering Australia. Top idea. I liked Gladys at the beginning, but not anymore. Much tougher restrictions need to be in place. That's Jenny. Tony from Stanmore. Chris, you nailed it. Gladys said her government would accept all recommendations from the police commissioner, and then later she rejects the 5 kilometre limit, for instance. This is dragging on longer than necessary. You're right. Sandra, Palmerston in the ACT, listening through the app. How's this for the incompetent ACT Labor Greens government? A relative of mine waited for 11 hours yesterday for a COVID test before being turned away. There were hundreds of cars behind him. They've had 18 months to get their ducks in a row, and they've fallen at the first hurdle. They're the problems in the ACT. In terms of ventilators, this was interesting from Dr. Nick Coatsworth yesterday. He tweeted that the hospital system, especially at the pointy end, ICU end, is not overwhelmed. He's saying the nation has over 2,200 ventilators for immediate use, and only 475 are in use, with only 33 of those used for COVID patients. Challenging, yes, he says. Tough on the front line in Sydney, unquestionably. But overwhelmed? No. It's interesting to know, isn't it? Andrew, go right ahead.
Hey, mate, I'm just here at East Campbelltown at Mawinda Road Sonic Healthcare.
Yeah.
6 weeks ago, I went and got my first Pfizer jab.
Beauty.
I've linked my Medicare to my MyGov and all this sort of stuff. Sonic Health can't say that I've had my first jab.
What?
And I've showed up now for my second jab with my wife, and she goes, no, you can't. And I said, I'm a construction worker. I need this second jab. And she goes, well, we don't even have proof of your first. You can't get your second. And I'm like, what?
Have you looked on the MyGov Medicare app?
I have.
And it's not there?
No, I had to do that Thursday night.
Oh.
I was on the phone to Sonic Health hotline number.
But, Andrew, wouldn't they have a record somewhere that you came in and got it?
They believe that they don't, and I'm disgusted.
Oh, that's outrageous. Like, you know, it's not hard to say, I've just given a jab to someone, write his name down and make sure it goes through the system. How disappointing. I'd be doing my block as well. Mark in Balmain. Go ahead, Mark. Hi, Mark.
Okay, because I haven't heard much about them. I'm thinking about kids aged, say, 12 to 16.
Yeah.
Mate, I'm fully vaccinated. My wife's fully vaccinated.
Good on you.
People are talking about, a deadline. The kids have as much right to be vaccinated as anyone else. And here's my point. I won't be able to put them on a flight with me. I won't be able to take them to the pub to have lunch with me.
No.
And, mate, they move around. They don't really get social distancing.
No.
They'll be getting on school buses. They'll be getting on trains. At some point, before we can open up, they're going to have to deal with, I guess, the teenage age group.
I spoke with Peter Doherty. He's the professor that owns the institute where we've got our vaccination threshold numbers from, the 70% and 80%. He said to me on Thursday that the kids must get vaccinated above 12 years of age, that the data from overseas experience tells us that we have to guard against their mobility because they are more mobile than you and I, Mark.
Mate, and I want to the kids want to go and see their grandparents in Queensland.
Yep.
It just has to be practical that they're vaccinated, and for health reasons and for the practicality of moving around.
Yep, well said, Mark. It'll happen. It'll be one of these things. We're going to slow down between 70 and 80% because there'll be people still up in the air about getting their vaccination, right? So we'll get to 70% really quickly. Then we'll have this snail's pace to get to 80, which is what the rest of the world has experienced. But we'll also have this snail's pace to get kids vaccinated. It's just part of it. And until we do, there are still great dangers in transmitting the Delta variant. 131873 is the telephone number. Kevin, go for your life, Kev.
Good morning, Chris. Yes, I'd like for you to suggest to the public that's got to sign in to take their own pen with them.
Yes. Oh, that is so right. I wrote my name on a book to get into a butcher's yesterday because my phone had run out of juice, right? And I wrote it, and I picked up, and he had one pen which was tied to the top of the pen and tied onto the book. And I thought to myself, everyone that's come in and signed that book has used the same damn pen, Kevin.
You're exactly right. Now, I was at a post office yesterday. There was two pens tied on with a piece of string, and the piece of paper that was there would have had 25 to 30 names on it.
Yeah.
But I can tell you a good story. Down at Coles at DY, they got security on the door and a table there for people to sign in, and they got two cups with about 7 or 8 pens in it. As you sign your name, the security guy takes that out and puts it into another one to be washed.
What a system! What a system! But the message is, Kevin, for those who don't do that complicated process or install that process, BYO pen. Well, the Canterbury Bankstown LGA community leader and Belmore Medical Centre owner, Dr. Jamal Rifi, provides a great voice for his community, as well as being a GP. He's also been flat out at his practice, not only getting vaccines into arms, but driving around delivering vaccines to his vulnerable patients. But along with the issue of making sure his community is jabbed, he's also committed to making sure that the residents of Canterbury Bankstown are informed as to the restrictions facing them during this pandemic, because the lines of communication are not always the way they should be when you've got a lot of people who don't speak decent English. Dr. Jamal Rifi is on the line right now. Doctor, good to have you on the program and good to chat again.
Thank you, Chris.
First, let's talk vaccines and availability. As a GP, what's your take on which vaccines you've been able to access, and have they been enough for the demand?
In Australia, currently, we have only 2 vaccines. The AstraZeneca, and it started vaccinating on the 22nd of March 2021, and also we have the Pfizer. Pfizer, we started on the 9th of June, and that's what we have available. We know that Moderna will be coming in the next couple of weeks and will be rolled out. We have enough supply, but we definitely can do with a little bit more, except the pop-up clinic is actually filled in that gap of our shortage. And also the fact that our pharmacies came in online and also they filled up that gap. So I reckon we are very well served at the moment. We have a surge of demand, and especially from construction workers and tradies, and we can meet with that demand, but we are lagging about 2 or 3 weeks behind.
I have a feeling that if the New South Wales government said today or tomorrow or the next day that those in hospitality, if you want to return to work in September, will allow that to happen, but you've got to have your jab, I think we'd see the same kind of surge we've seen in construction, would we not?
Absolutely. I reckon that's the best incentive for people to be vaccinated. It's second to the fact that they should consider always that this Delta variant is highly transmitted, and it is a lot different from the Alpha variant of last year. And also it affects many people. So the best incentive is to protect yourself by getting vaccinated. And we have very good vaccines. They are available. They are free of charge to everyone, regardless if they have visas or not. And second incentive is if they allow them to go back to work, I reckon overnight our numbers, our demand will triple, and we are already under the pump right now. And the appeal is to do this in stages so we can cope with it.
Yeah. Now, to the restrictions. People caught breaching the public health orders, not complying, will now face fines of $5,000. Your reaction to that increase from $1,000?
It should be always coupled with an information campaign about the restrictions themselves and also informing the public. And I reckon, without any doubt, a grace period should be there, because a lot of people are affected financially and emotionally, and they are restricted in their movement. If they are doing this on purpose, throw the book at them.
Yeah.
But if they're doing it because they don't know or they haven't learned about the changes, and there is too much rapid changes taking place, I think initially probably we should alert them to this fact. But what we will do right now, we, myself and other GPs in the area, we will definitely hit the radio waves, talking to them in their own language,
yes,
and also on social media, and at the same time through the local newspapers, to let them know that the penalty have increased, but for everyone to avoid that penalty, they should comply with the public health order, and the public health order is X, Y, and Z.
Yeah. What about this suggestion from New South Wales Police that we've got to prevent people being mobile, so we want a 5-kilometre radius in place if you want to go and exercise? Now, we understand that Gladys Berejiklian initially said, no, that won't be happening. The police minister and also, as I understand it, the police commissioner were still trying to get Gladys Berejiklian over the line. She may be over the line. Do you think this is important? Because I get the feeling this has been used as an excuse for people to travel wherever they want as long as they're within 10 Ks.
Chris, this Delta variant broke all the rules.
Yeah.
And for us to contain it, to stop the spread of this highly contagious variant, our only tools that we have is to limit people's movement or to vaccinate. And short of imposing a complete lockdown and stopping people movement completely, the 5 kilometers is more than enough for people just to be able to change from their home circumstances to outdoor and to even walk.
Yes.
Except, I can tell you, we have been in this lockdown for 7 weeks. Unfortunately, the numbers have stabilized, but it's not coming down as much as we can.
Oh.
And we need to do our best to contain it, stop it from spreading, and the virus it doesn't go from one person to the other by itself. It needs someone to carry it from this household to that household. We need to intensify our message that stay at home, don't visit anyone, don't accept any visitors, and limit the movement, especially between suburb and from one area to the other.
Yeah. You're a voice of great reason. They're very lucky to have you in the southwestern part of Sydney. Jamal Rifi, thank you very much for your time this morning.
Thank you, Chris. I'm the lucky one to be in southwest Sydney. It's a great community.
Yes, exactly. Good on you, Dr. Jamal Rifi. And those numbers in Canterbury Bankstown with Fairfield have seen a great deal of additional compliance in the last 4 days, according to police. So that's good news that people in Fairfield, and a lot less infections occurring in those two areas. They're still high, but a lot less than what we saw before. As he said, Delta broke all the rules. One good rule that has been introduced, and we'll hear about it today at 11 o'clock, is this $320 stay-at-home payment, which will be introduced for residents in Sydney's hotspot areas who need to isolate while waiting for their test results. Now, a lot of people don't get enough motivation to isolate, so they think, I've got to get to work. I can't wait for this test result. I've got to go to work. Well, you're only going to spread the virus if you've got it. And this is first introduced in Victoria. Dan Andrews introduced this, one of the rare things he's done well. But a stay-at-home payment like that then pays for the shift you miss or the day's work that you miss and the payment you miss because you have to isolate until you get the result of the test. So I think this is a good move too, $320 stay-at-home payment. We'll take a break. get to your calls, and we'll also get your calls on home improvements too, because Ask a Tradie just around the corner. An update from Queensland, though, for you. No real news. 6 new local COVID cases, all in home quarantine. All in home quarantine. No dramas out of Queensland today. 23 minutes after 10. Yeah, one listener has suggested that maybe we could alert people by SMS. You could alert them of the new fine of $5,000, the new 5-kilometre rule, if it does get implemented today. We could do this by SMS to make it easier. It's not a bad idea. Claudine wants to comment on this $320 stay-at-home payment. What about the other people who've been fully vaxxed and stayed at home as per health order to have minimal contact? What about the sole trader, the SME who doesn't qualify for help, who has a business gone bust? I know of nearly 2 who've done that. Is the person who is constantly getting tested because they're moving through the community going to get the payment multiple times and rort the system? I, like thousands of others who are at home and not moving around and vaxxed, don't get extra payments. It's a fair point, isn't it? And you worry about whether the $320 ends up in the pocket of people who are getting, tested every 3 days. Do they get that 3 times a week because they're getting tested 3 times a week? Is that the way it works? 131873. Steve in Penrith. Hi, Steve.
Good morning. How are you going,
Good,
Chris?
thank you, mate.
Yeah, well, I was just up at Nepean Hospital getting a walk-in COVID clinic. I got there a bit early before they opened. There's a queue of people. And a woman in the queue sort of walks about 3 or 4 metres away from everybody, takes a mask off, lights up a cigarette, and just starts blowing cigarette smoke. And it's going all over the people in the queue.
Oh, no.
She got told very smartly, put the cigarette out and put your mask back on.
Oh, did they?
And she just sort of gave everyone a sour glare and just sort of walked off into the car park, still smoking a cigarette.
Anything for the ciggy.
Is there any wonder the situation's as bad as it is in New South Wales with people like that? Just don't care.
Yeah, that's
no
an
regard
interest.
for anybody else.
How many people told her off?
Oh, there were 2 of us. I was one, and there was another guy.
Yeah.
Yeah.
Yeah, not quite effective, is it, when you do that? Thank you, Stephen. 131873, the telephone number. Susan from the Central Coast, one of our listeners, phoned in to say the Central Coast is packed this morning, and she actually thinks people from Sydney are making a beeline for her area. Well, how do you stop that? Unless you're pulling over every car that runs up the Pacific motorway, how do you stop that? Especially, if you're that selfish, that keen to get out of Sydney, you don't have enough police officers in New South Wales to stop every car, do you? Kevin in Maryland. Hi, Kev.
Yeah, sure, Chris. What a great day.
Beautiful day.
Anyhow, this is about Ronald McDonald House at Westmead.
Yep.
It's the first one in Australia. The money to build that was raised by a group of women. And I'm going back a long time.
Yeah.
One of those women called Ivy, her son was in the old Canberra Town Children's Hospital.
Yeah.
When she went in to see her son, the hospital was supplying mattresses on the floor so people from the country who couldn't afford motels, there wasn't that many around those days anyhow.
Yeah.
So they were sleeping next to their children that were sick, and a lot of those children were dying.
On the floor.
So Ivy said, I could do better than that. So she contacted Ronald McDonald's in America. They told her if she could raise the funds, they'd support her. Well, all those girls got together, and they got into small groups, and they went into police stations, ambulance stations, anywhere to get the money.
Yeah.
And one police station today, most of the police stations, of all the police stations in Australia, in New South Wales, support Ronald McDonald's House.
Yeah, good on them.
Now, you had Dennis Shanahan on.
Yeah.
Well, my wife had a market research company, and she knew Dennis very well. And she had contacts. And she told me that she'd been talking to some of these CEOs from the major corporations in Australia. She said they're the nicest people you could talk to. And she said they all agreed they'd support Ronald McDonald House.
How good.
Now, I don't know how much money she raised and what the money that the girls raised, but they built it. Anyhow, this Ivy, her nephew works with you at Sky News.
Oh, right. Yes.
Yeah.
Kevin, yes. Very true.
Yeah.
Very true. Is your wife still with you?
No, she passed away.
She passed away.
October.
What a great legacy, though, Kevin. You must be very proud of what she achieved.
Yeah. Kieran Gilbert worked with you there.
Yeah, absolutely. Yeah, the Gilbert. I went to school with the Gilbert family.
Yeah, I know. You went to St. Fairfield Patch.
Yeah, exactly.
Yeah, and I was at Fairfield Patch when I met your father, Norm.
Oh, that's great.
And my wife asked you to see if you could find my son, John. I don't know if you remember, that's a long time ago. But my son, Philip, was playing football there with Sterlo, and that's the days when Sterlo had some hair.
Yes, a lot of hair then.
Yeah.
Good memories, Kevin, good memories. I'm glad you called in to say that. Thank you very much for your call.
Okay, Chris, good luck to you.
All the very best. Thank you, mate. Much appreciated. Can we get to Janine? Let's try and get to Janine in Penrith. Hi, Janine.
Hi, how are you?
Good, thanks.
Okay, I'm a little bit over all the government being hit hard about the COVID, the vaccination, people not getting done. Full credits to Gladys Berejiklian and Scott Morrison for what they have done. What I think they should do now is just say, look, 30th of August, that's it. We're going to open up. If you're not vaccinated, the onus is on you. It's not on us.
I don't think it'll happen on August the 30th, Janine, but it will happen, as they say in the commercial. It will happen, and it could be as early as January, February next year. I think it'll happen.
Enough. It's not, there's too many businesses, Chris, going broke.
Yeah, I understand. I understand.
Now.
We need to open up, but, according to what the Doherty Institute says, we've got to reach 70 and then 80%. And when we reach 80%, we're at that point where we can save lives at the same time as well as open up. I think we've got a little bit of time to wait, Janine, before that happens. And you're right. There are jobs being lost. There are businesses and livelihoods lost as well. This is a different kettle of fish now. That argument was always valid and is valid, except when we're talking about Delta, and we've got to just hold on a little bit longer until we get to that 70%, start opening hospitality, all of that, and then 80%, we're over the line, and those who are not vaccinated, that's fine. They take the risk. It's 26 to 11. We'll take a break. Come back with your calls for Ask a Tradie. 23 minutes to 11 o'clock.
On the Chris Smith Show, Ask a Tradie, brought to you by Vigola, the original open-closed roof system.
Good morning, Simon Stevenson.
Good morning, Chris. How are you today?
I'm doing very, very well. Busy week?
Yeah, very busy week, thank you. Yes,
good.
It's been getting a lot of work done.
A lot of momentum now back into the construction sector, right?
Absolutely.
Yeah.
It's very, very busy out there. Local hardware store that, to me, I've never seen it so busy. It's crazy.
Yeah, great stuff. All right, Deb writes from North Curl, and by the way, if you want to ask Simon a question on anything related to home improvements, doesn't matter how small it is, can be the size of your nails, the size, not those nails, those other nails, and the size of your screws, all the way up to doing an entire home renovation. Give us a call on 131-873. Deb from North Curl. I have a question for Simon. I'm in the process of repairing our deck and would like to know the best modified wood to use. We are not very good at maintenance. We only get the morning sun on our deck, and we'll have a barbecue and furniture on it. I've been researching and have samples of Bright, B-R-I-T-E, and Mod Wood, but I'm finding very mixed reviews. I can't tell the difference between the real and fake reviews. Can you be of any help to Deb?
Yeah, look, I mean, I've used a few different products, Chris, or I've had them used on clients' homes. I think it's really important, though, to remember there's a big difference between these man-made timbers or composite decking boards compared to real timber. They do get hotter in the sun, so they're not like a cool to touch. So if you're walking on them in bare feet in the sun, they can be dreadfully hot under feet.
Right.
The spacing between the joists sometimes need to be closer as well, because it is a man-made timber, so it is glued together virtually and a composite timber. It doesn't have strands, so it is not as strong as what a timber would be. And also fire ratings, you need to look at things like that. So just because you think you're getting a composite decking board, it doesn't mean it's going to be better and to suit your environment, especially if you've got kids around. It can get scratched and damaged as well. So it is important to do research. I've used one called Next Gen Decking, which I found was very, very good, but there's so many different ones on the market at the moment, and it is important to do your research. And they do cost more than timber, a lot of them as well.
Yeah, right. They cost more. Well, that's interesting. Maybe she should be considering some, I don't know what you call it, but plain timber decking as opposed to something more modified.
Yeah, look, I mean, I'm a huge fan of the hardwood decking. And look, if you want to, if you buy a good quality hardwood, you don't need to recoat it all the time. Some of them, I mean, I've done a deck where we've left it outside for years and years in the full sun with no coating on it all, and the timber's just gone grey. And it still looks like the day we did it because, you know, timber can last outside. You don't need to oil a deck. You can if it's done in a good quality hardwood decking. You know, we used a Merbau outside, really good.
All right, good on you. There you go, Deb. There's another bit of information you might want to take on board, and from a reliable source too, so you've got no problems in terms of where you're getting the information from. Sometimes those review sites, you don't know who's mocking a product for the sake of, you know, protecting another product. There's all of that goes into those review sites. You've got to be very, very careful. Nick wants to talk about laying turf. Go ahead, Nick.
Hey, Simon. Mate,
good morning, Nick.
Yeah, just laying down some turf at our place here, and I've got some that's in the shade, but it's pretty raw dirt where I've got it. I'm just trying to work out what the best preparation is in preparation for putting that turf down.
Look, I think generally it's got to have a good base. If it's rocky, you know, the ground has to be soft enough for the roots to take. So you might need to you know, to get a machine from Kennards or something and just dig the soil up and rotate it so you can get the roots of that grass. Very important to put a light topsoil over it once you've laid it, and watering constantly, like, you know, while those roots sort of bed into the ground as well. So, you know, my suggestion would be, depending on the grass you're using, make sure that ground's really good. I think sometimes they'll even use like a coarse river sand to put down first as well. But the company that you bought this turf from should be able to give you some information as well if you want to contact them.
Okay, perfect. Thanks, Simon. Appreciate it. Big fan of your show.
Good on you, Nick. Thank you very much for the call. Chris in Turramurra. Morning, Chris.
Yes, good morning. I've got an aluminium table that's rusted. How do I clean it and repaint it?
Rust off an aluminium table.
Okay, if it's aluminium, it'll be corrosion, and usually it's white in substance, so it'll leave like a white sort of fluffy surface on it. Corrosion from aluminium is... Okay, so it won't, if it's rusty and it's...
aluminium.
Okay, yeah, that's what I was about to say. If it's rust and it's brown, it will not be aluminium. Brown rust only happens on regular steel. So you might want to sand it back, wire brush it, whatever you can, remove as much rust as possible. Use a rust converter, something like the Ranex Rust Buster, and then look, I'm a big fan of Norglass paints. Norglass, you can use some of their Weatherfast or the Northane over the top of that, and it'll last for many, many years.
Yeah, good luck, Chris. Get working on that steel brush. That's the first. That's the first chore you've got to have. Graham from Kenthurst has phoned through, talking about a windowsill. Go ahead, Graham.
Hi, Chris. Hi, Simon.
Hi.
How you going?
Morning, Graham. Good, thank you.
Yeah, I've got some old timber windows. I've just recladded my house, but the windows are about, I don't know, from the 50s. So the hardwood sill's okay, but it's flaked and cracked and all that. And I remember years ago you said something about, was it using a waterproof membrane to seal it and then fill it, or I can't recall.
Yeah, absolutely. So, look, if you can remove as much of that old paint, watch out. 50 years ago, it'll have lead paint in there. So you might want to use something like a citrus strip or a sander with a vacuum cleaner or wet sanding just whatever. Just be very, very careful. Use your mask.
Right.
An oil-based primer over that, so it soaks into the timber, and thin that by 10%. And then from there, I put a waterproof membrane over, a few coats, 2, 3, 4 coats of waterproof membrane brushed on. It's like putting a rubberized coating. It's put a rubberized coating over that timber. Now you're talking about a water-based waterproof membrane.
Like you use in a bathroom, basically.
Yeah, exactly. But look, better have one at Bunnings called Weather Seal, I think it's called, and it's just virtually a white paint. And then you can go over it with a water-based enamel over the top, something like Wattle Aqua Trim or something like that, and it'll flex and move and won't crack again.
Brilliant. Okay, thank you very much.
Good on you, Graham. Thank you. Hopefully that's helpful. We've got a couple of text messages and some questions on there or from there as well we'll get to. We'll come back after a break with Simon Stevenson. I've also got the first question in the rolling quiz to get to as well, all coming up after this. We will find out where New South Wales is up to in terms of these overnight infections and the trajectory up. At 11 o'clock, we'll go live to that press conference as usual. Now, first question in the rolling quiz. 2 fabulous prizes. The much sought-after Spinalese pillow to fix your neck pain, your headaches, your snoring. If you want a great night's sleep, you must have a Spinalese pillow. Spinalese, EZE.com.au. I have one. I love it. And a $200 car care pack from Valence environmentally friendly car care products, which got another workout at my place during the week. This is revolutionary. I keep saying this to you, but if you want to treat your car like the enthusiasts treat their vintage and veteran cars, this is the car care product you need from Valence, Valence. All right, first question. How many straight edges does a cube have? How many straight edges does a cube have? That's the first question in the rolling quiz. Let's go to Rob in Botany, who's got a question for Simon. Go ahead, Rob.
Hey, Chris, how are you? That lady that said she had rust on the aluminium table, it is possible it is an aluminium table, but rust from a nut or bolt that has been sitting on there. So I just thought, rather than get into it with a steel brush, might be better to have some other suggestion. I'm not sure what your thoughts were, Simon.
Yeah, look, I mean, generally, these aluminium tables, if it's down near the bottom, you're right, it could be a bolt that's holding it, but you'd still need to remove the rusty surface and then treat it with a rust converter anyway. So, if you've got a brown rust coming through there, definitely have to treat it and coat it. But, thank you for the call.
I'm not sure if you understand completely. What I'm saying is, like, if there was a washer or something on the aluminium table and the washer got taken away, and left it for a period of time, it leaves a rust stain, you know what I'm saying? So,
Yeah. Look, I mean, you could use something like CLR if you've got a rusty mark on something, or even that Ranex Rust Buster. I have removed rust using that as well. It will just clean that surface down.
Yeah, good point. And it could be a component, a steel component that's shifted rust, but you're probably right on the money in the early stages when we had the caller on air. Now, Tanny wants to ask you about what the best plantation shutters would be to purchase, the best plantation shutters.
Look, plantation shutters, there are plastic ones now, there are cedar ones, there are all sorts of different ones you can buy. Personally, I would probably look into some of those plastic ones. They're very good, or vinyl. I think they're made out of like a vinyl. There are many, many different quality made ones. So be very, very careful, because I did see a bloke at a tip one day pulling some plantation shutters out of the back of his van, taking the boxes off that said made in China and throwing them away and putting them back in his truck. I said, why are you doing that? And he goes, I'm going to tell them it's Australian made.
Oh.
So be very, very careful when you are, go to somebody that's reputable for installers and just look at the quality of them and try and check reviews as well.
Yeah, good advice. Another one here from Mary. Can I write to Simon, care of 2GB? I want to send him a picture of my problem and get his advice, please. That's Mary. What's the best address to send a letter to?
Look, if she wants to write a letter, she can send it to the station and I can get it from there.
Yeah.
Or she can send me an email, simon@simonshouse.com.au.
Okay, fantastic. Mate, I've run out of time, but thank you very much for yours once again, and we'll catch up again on Saturday morning.
Thank you very much, Chris.
Good on you. Simon Stevenson, Ask a Tradie. Interesting comments during the week from Prince Charles. I don't know whether you're across this, but he says he can't see a way that Prince Andrew will be allowed back into public life because he fears the sex scandal has caused lasting damage to the monarchy. The Duke of York, 61, is said to be having crisis talks with lawyers and visited his mother, Queen Elizabeth, at Balmoral this week, supported by daughter Princess Eugenie. Australian woman Virginia Roberts Guthrie is suing Prince Andrew via a civil lawsuit in which she claims she was forced to have sexual intercourse with Prince Andrew against her will and lists offences including rape in the first degree. Prince Andrew has categorically denied the claims. And it's interesting, the other story to come out during the week about Andrew was his lifestyle. He lives the life of a billionaire. He bought a £13 million Sky chalet in a swanky Swiss resort. £13 million, mind you. What's that, $25 million, something close to it? He also splashed out £7.5 million to refurbish the Royal Lodge, his 30-room mansion in Windsor Park. That's just on renovations, £7.5 million. He has bought an 18-carat Apple Watch, estimated to be worth £12,000. And then when he left Prince Philip's funeral earlier this year, he left in a flying spur Bentley. It was green, but they don't make them in green. So he's had to get them resprayed green. I don't know how much that costs, but I can tell you how much the flying spur Bentley costs. £220,000. £220,000 for a Bentley. Just the life of a billionaire. Unbelievable, isn't it? And I like what I heard also. A slice of cake from Princess Diana and Prince Charles's 1981 wedding has been auctioned for the equivalent of 2,565 Australian dollars, a piece of wedding cake. It was a bloke from Leeds, Jerry Layton, purchased the slice through an auctioneer firm in England. The slice of cake only weighs about 28 ounces and was preserved inside plastic wrap and a cake tin. $2,565 worth of cake. All right, we will be getting to that press conference at 11 o'clock. I just want to say this, though. This is a good thing that's now working, courtesy of Service New South Wales. Sue from Kingswood writes from the ACT, I went on the service page yesterday, so she's in the ACT, mind you, ordered my identification card to check in and out of locations. So this is the card you have if you don't have a smartphone or you don't want to write down on a pad that you're entering a place. Very easy to fill out, and you can either print it out or have it sent by the post. Much easier than writing your details. Okay, just waiting to go to that press conference. I understand that the Police Minister and Police Commissioner will be at that conference. That sends to indicate that maybe the Police Commissioner did get his way. It'll be a very uncomfortable press conference if he didn't get his way. So we'll go there as soon as we see the Premier emerge, and she has done that and standing at the podium right now.
For a COVID update, let's listen in.
It's the most concerning day of the pandemic that we've seen in New South Wales. I certainly will not be detracting from that strong message. We had 130,000 tests overnight. And very concerningly, we had 466 cases of community transmission. This is the largest jump we have seen in a night, and it's fair to say that we are on a par of being extremely concerned about the situation that we're in New South Wales. At least 60 of those were infectious in the community, but that number is likely to go up given a number of cases are still under investigation. Unfortunately, we had 4 deaths overnight, and we extend our deepest condolences to each and every one of the family and loved ones. As I say every day, we read out the statistics, but behind each statistic is a human being with loved ones they've left behind, and our heart goes out to all of them in these tragic circumstances. We had a female in her 40s who was in palliative care. She wasn't vaccinated at Concord Hospital who passed away. A male in his 70s, he was vaccinated but did have pre-existing conditions who died at Liverpool Hospital. A male in his 80s who died at Concord Hospital who wasn't vaccinated, and a female in her 70s at Campbelltown Hospital, but we've yet to get further details as her death was only reported very recently, and we'll be able to provide further updates as they come to hand. As I said the last few days, we are seeing stabilisation in the Fairfield and Canterbury-Bankstown local government areas with ongoing decline in growth of cases, and pleasingly those 2 local government areas have gone from low levels of vaccination to at least 40% of first doses, which contributes to the concerted targeted approach we've had in those local government areas. But the main suburbs of concern in and around Western Sydney and southwestern Sydney are, and I really want people in these communities to take heed, Blacktown, Doonside, Mount Druitt, Merrylands, Guildford and Auburn, where we're seeing the largest areas of growth. In regional New South Wales, concerningly, Western New South Wales, so Dubbo and the surrounding communities, has seen 26 cases overnight. And it is likely that Health Advice today will ask us to extend the local government areas in lockdown. Most of far western New South Wales is already in that situation, but there were a couple of local government areas outstanding, and I suspect we'll be getting that advice later today. Hunter, New England had 16 cases overnight. Armidale, Tamworth and Northern Rivers still remain at 0 cases, but obviously Health is watching those circumstances, and whilst Armidale still has 0 cases after a week, Health has recommended that lockdown be extended for a further 7 days to make sure that there aren't any undetected cases, given the information Health received has changed from those concerned in the first few days of being detected as positive. So whilst those 3 areas have had 0 cases, Armidale, the community of Armidale will be asked to stay in lockdown for at least the next week. Can I say on a positive note that New South Wales has pretty much reached 50% of first doses vaccinated. We know that the lockdown coupled with a strong targeted vaccination program is what is going to get us out of this dire situation. Vaccination is key. Don't wait. Please come forward and get vaccinated. Pleasingly, tomorrow we have around 10,000 tradies and construction workers in those local government areas of concern in Greater Sydney who are getting the vaccine. And during next week, 100,000 authorised workers in those local government areas of concern will be getting vaccinated. And we know that not only will that keep themselves safe and their families, but it will help reduce the spread, because people in certain jobs have to work and they may not have symptoms, but they may have the virus. This is the nature of Delta. It is something we haven't seen before and is spreading in a way we've not seen before. And if we want to stop the spread, we need to get people vaccinated. So thank you to those who've come forward. Please continue to do so, and don't wait for one or other vaccine. Please come forward and get vaccinated. I also want to provide an update regarding the activities of the New South Wales Police. As we stated publicly this week, Commissioner Fuller, the Minister, myself and our team have been in contact about what police need in relation to escalating their compliance efforts to make sure that the whole of government response in relation to compliance is done as adequately as possible across the state. And of course, we note that it only takes a handful of people to do the wrong thing. And I know that the vast majority of people are doing the right thing, and that's a positive. We know that in some of these local government areas of concern, the streets are bare, people are staying home and doing the right thing, but it literally only takes a handful of people to do the wrong thing, to have a super spreading event, an unauthorised gathering, and we have a major, major setback. And that's why it's so critical for the police to be given these additional resources. And I want to thank Commissioner Fuller and Minister Elliott for their direct involvement in this process. There's 2 categories of changes in relation to policing that I want to briefly mention before Dr McAnulty will give the health update and Police Commissioner Fuller will then also make comment. Firstly, in relation to police operations, there will be a visible and increased police presence in the affected local government areas, including deployment of specialised commands and including a riot squad, highway patrol and increased presence more broadly. From Monday, there'll be 500 extra Australian Defence officers on the ground as well, following a request by New South Wales Police. There'll be enhanced random checkpoints at key roads with accompanying electronic warning signs so that police have every ability with that increased presence to clamp down on people doing the wrong thing. From Monday, the health orders will be formally enforced from midnight. However, between now and then, police will still be able to impose these additional fines, even though the health orders kick in on Monday morning after midnight. Between now and then, if police have evidence that you're doing the wrong thing in any of these categories, these additional fines will apply. So $5,000 for on-the-spot breach of home quarantine, which is currently $1,000. $5,000 on the spot for lying on a permit, which is already a criminal offence. $5,000 on the spot fine for lying to a contact tracer, which is already a criminal offence. $3,000 on the spot fine for breaching the two-person exercise rule in any way. $3,000 on the spot fine for breaching rules going into regional New South Wales. In Greater Sydney and other lockdown areas, but not the local government areas of concern, the 10-kilometre rule will come down to 5 kilometres. So you can obviously do activity within your local government area, but instead of 10 kilometres from your home, it will be 5 kilometres from your home, and that's for all of Greater Sydney. All those areas which aren't the local government areas of concern will now have imposed on them the 5 kilometres instead of the 10 kilometres. In affected local government areas, we want to stress that exercise means only exercise and supervision of children. So the word recreation will not leave any doubt. That word is taken out in terms of those local government areas of concern. Exercise means exercise. Many people know that, but unfortunately some people were trying to get around the rules that were imposed. In affected local government areas, you will need to register your single buddy to make sure that people aren't abusing that rule. And also, importantly, for regional New South Wales, you will need a permit to go into regional New South Wales, whether you're an authorised worker, whether you're travelling to a second home because you might be a worker utilising a second home, or whether you're inspecting real estate. You will need a permit. The permit system will be effective from next Saturday, but obviously between now and then, police can stop you and seek evidence for what you're doing, and if you're doing the wrong thing, you'll have those extra fines imposed. Obviously, we've also tightened the rule, as was foreshadowed, around inspection of real estate property and others where it's limited to one person. And only one person, of course, can travel to a second home. So these are additional resources and additional penalties and tightening of orders in some circumstances to provide police all the resources they need to be able to ensure that compliance is maintained at all times and to ensure that the small handful of people doing the wrong thing are prevented from doing the wrong thing. I'll now ask Dr McAnulty to provide his health update and then Commissioner Fuller will talk about the increased police presence and the police operations, and then, of course, we'll take any questions. Thank you.
Thanks, Premier, and good morning, everyone. Just give you an update of the numbers overnight. As the Premier said, we've seen a very concerning upswing in numbers for yesterday, with 466 locally acquired cases of COVID-19 reported to 8 o'clock last night. There was one overseas acquired case in the same period. We had outstanding testing results, however, with 129,352 tests reported to 8 o'clock last night. By isolation status of the 466 locally acquired cases, 76 were in isolation throughout their infectious period, 19 for part of their infectious period, and at least 68 were infectious in the community. In terms of hospitalisations, we currently have 378 patients with COVID in hospital, 64 are in intensive care, and 29 require ventilation. And again, we're seeing a range of ages, including relatively young people in intensive care. 4 in their 20s, 6 are in their 30s, and 7 are in their 40s. We have seen an increase in sewage detection in concerning areas of the state, Broken Hill and Ballina and Brooklyn, just north of Sydney. So we're urging people who live in those areas where we don't have identified cases to please monitor very closely for symptoms and come forward for testing at even the slightest of symptoms, so we can find if there are cases in the community who are contributing to these positive sewage findings. So please come forward for testing, help us find and control any further spread in those communities. In Western New South Wales, we're still seeing cases emerge in the outbreak that's affecting primarily Dubbo and Walgett. Public health units are working very hard there to identify cases, work with the community to make sure that people are tested and identified should they be cases. Please come forward for testing. We know that some people wait some days with symptoms before they go and get a test. It's really, really important. Assume it's COVID until proven otherwise. Go and get a test at one of the many clinics around the state if you have any of the mildest of symptoms. Thanks very much.
Good morning, ladies and gents. Thank you, Premier. Thanks, Minister. The New South Wales Police Force will launch Operation Stay at Home Sunday at midnight. New South Wales Police will be supported by the Australian Defence Force. As you know, there are already 300 men and women of the ADF on the ground, and an additional 500 will come online from Monday. During the week, the Police Minister and I approached the Premier about some enhancements to the health order, and most of those were requests that came from the field, the police in the field, who were having difficulties getting compliance from some members of the community. The movement, particularly in Greater Sydney, was way too high from our perspective in terms of what we were trying to achieve. And our part in this is to get New South Wales Health ahead of the Delta variants. The fines are some of the biggest fines that I've ever seen, and we will be issuing them as of today. So can I say to the members of the community out there is that you may think that leaving your LGA to train is okay, but it's not. You've got a 5K limit now from your house in Greater Metro Sydney. We will be enforcing that. You do have to carry identification. There's a whole range of other health orders that we can use against you. I closed the first business this morning, a cafeteria at Leichhardt, for 14 days for continual breaches of the health order, and I won't apologise that more businesses will be closed over the next 21 days. The permit system is essential in terms of protecting regional New South Wales, and I would ask from Monday there will be information online on the government website in terms of how to access a permit, and the permit system will come in place midnight Friday next week. I think it's important that those people who have been getting around the orders, taking family vacations to other premises, that is over. The permit will only allow generally one person to travel for what is essential business. Premier spoke about the assets that will be involved in this operation. There are 1,400 men and women in the New South Wales Highway Patrol who now will be dedicated to COVID compliance duties on our roads. You would have seen roadblocks both south and north over the last couple of days, and across Greater Sydney and into regional New South Wales. Expect to see more roadblocks where we'll be checking with compliance. Some of the strongest laws, some of the strongest police action coming. I'm not apologetic. Please don't write and complain to me. We've given ample warnings and cautions. That time has gone. Thank you.
It's now day 50 of the lockdown. On record number of cases today, 466. Why has it taken you 7 weeks to further strengthen the current restrictions?
It's apparent that when you are dealing with the Delta variant, as we've seen in other parts of the world, you need to take the best advice but also be flexible as the pandemic moves forward. And it's really important for us that when we see a new front, that when we see action that we need to take, we take it immediately and decisively, and that's exactly what we do. It's also important for us to explain every step along the way to the community. And again, I want to thank the vast majority of our community is doing the right thing. And every day I feel the burden intensely of what we're asking our citizens to do. What we're asking our citizens to do has been the most difficult decision of my life and the most difficult decision our government hopefully will ever have to make. But it's to keep our community safe. But I appreciate our community also understands the changing nature of the Delta strain and our ability to move with it, to get in front of it. And the case numbers overnight are very concerning, extremely concerning. We cannot see this trend to continue. And whilst the vast majority of people are doing the right thing, too many people, a handful of people aren't, and that will have devastating consequences because the Delta variant leaves no room for error. If you look overseas, even in communities with high rates of vaccination, they have thousands and thousands of cases every single day. And that's why, for a long time, we've been urging our citizens to come forward and get vaccinated. Vaccination is our key to getting us out of this difficult situation. No doubt you need the lockdowns. I don't resolve from that for a second. But the vaccination, getting our vaccination rates up, will keep people out of hospital. Because the important number for us to remember is the number of lives we save, the number of people we keep out of hospital. So I urge everybody, if you have a loved one that isn't yet vaccinated, especially if they're vulnerable, especially if they're active because they have to leave home to work, please make sure you urge them to get vaccinated. I can't say that strongly enough. And I wish we weren't in this situation. I wish things were getting better. But this is the nature of the Delta variant. And I think for some time, we thought Australia was different to other parts of the world, but we're not. And we have to deal with it as best we can, and I know we will. I have absolute faith in our citizens, as I've had from day one. I have faith in all the people that are working together in government with community, even with non-government organisations to get support to people who need it the most. We will get through this, but September and October are going to be very difficult. At the end of October, we'll have 70% double doses of the vaccine. By mid-November, we'll have 2 doses of 80% of the vaccine to adults. And until that time, September and October will be difficult, as I've said. And the challenge for us is to see how freely and safely our communities can live during September and October. And the key to this, however, is not seeing the case numbers escalate but come down, and a key way to help us do that is the vaccine. But I do want to stress to people, just because you've had your jab, don't feel confident. It takes 3 weeks for the effects of the dose to work in your body. As Dr McAnulty will say and Dr Chant will say, it takes 3 weeks for the dose to actually work once you've had it. So don't think that you're immune, you're not going to get it. Quite the opposite. You will still be exposed for at least 3 weeks, and even after then, you still have to act as though you've got the virus or others do. Because when you have a proportion of the community that's not vaccinated, they're extremely exposed, and that's why we're very worried about our Indigenous communities in Western New South Wales, and that's why we asked the federal government to get us Pfizer doses into those communities, and I'm grateful that they did that in the last 48 hours, and I thank them for that. But it's really, really important for us to acknowledge and accept that we need vaccination as a key tool in fighting this. This is literally a war, and we've known we've been in a war for some time, but never to this extent. And I know that we will get through these difficult times. We always do. And I never, ever, ever give up hope that our citizens will enjoy those freedoms we did before the outbreak as soon as we can.
Premier, you know you've been in a war for some time then. Why has it taken 7 weeks to get to this point?
I say to the people of this state, we've brought the community along with us every step of the way. We've accepted the best advice, and we've kept people out of hospital and kept people alive and made sure we did our bit in getting as many jabs in arms as possible. Can I say what a great deal of pleasure it gave me to learn last night that in those 2 local government areas of particular concern right at the beginning of the outbreak in Fairfield and Canterbury-Bankstown, we had very low rates of first dose vaccinations. Now we're over 40% in each of those areas. Now that will help us, and those areas significantly have also seen a stabilisation or reduction in cases, and that's because we know now what it takes to have that consistent, targeted approach, local government area by local local government area to make sure that we are dealing with each community according to their needs. Whilst we are one New South Wales and one nation, we know that different parts of our state have different needs, and we have to respond to those accordingly. And I appreciate the patience that people have exercised. I appreciate the frustration. And I also want to let business and individuals know the disaster payments, obviously, you go through Service Australia and that kicks in every single week. You don't need to reapply. And with businesses, I want to give the community an update that the wait times now for getting your application sorted is down to 10 minutes, and you'll have the money in your account within 4 or 5 days. So please know we're doing everything we can to reduce your stress, but we're also asking you more than ever before to protect yourself and your loved ones. These high rates of cases day on day in the past week have demonstrated now that the virus is circulating in higher numbers than we've ever seen in Australia. And we need to make sure that we have as many people vaccinated as possible, because the statistics and the facts are higher rates of vaccination are saving lives, keeping people out of hospital, and at the end of the day, that is the statistics that matters the most. How many lives?
I will leave Gladys Berejiklian there. She's very keen to answer these questions in long-winded fashion at the moment. I don't know what that means, but they are 6 and 7 minute answers to questions, and I don't think she's answering the question. However, let me recap the most important aspects of all of this. There are suburbs in Sydney now that are very concerning. As a matter of fact, the Premier said this is the most concerning day of the pandemic thus far. But the suburbs where people need to do the right thing, because COVID is running through these suburbs at a great rate and a great ratio: Blacktown, Doonside, Mount Druitt, Marylands and Auburn. Blacktown, Doonside, Mount Druitt, Marylands and Auburn. Also 26 additional cases in Dubbo overnight. That will be a great concern, given the large numbers of Indigenous Australians in the Dubbo local area, because, as we know, that particular community don't have the same, well, they have pre-existing conditions, a lot of those Indigenous individuals, so that will be a worry in Dubbo, and 16 additional cases in Newcastle. As for these new fines, etc., let me go through them. Increased fines of up to $5,000. Now, you've got that $320 COVID test and isolate support payment, which is replicating what has gone on in Victoria for quite some time. There'll be permits from next Saturday to enter regional New South Wales, a heightened police presence and a heightened presence of Australian Defence Force personnel, 500 coming on board from Monday, and also 1,400 highway patrol officers will be called into the COVID Operation Stay at Home, according to Mick Fuller. Now, in Greater Sydney and other lockdown areas, the 10-kilometre rule will be reduced from Monday, with shopping, exercise and outdoor recreation to be done in a person's local government area to 5 kilometres from home. I've already had some emails to say, well, hang on, my nearest shopping centre is 8 kilometres away. Well, there's only one answer to that. You're going to have to either get a special permit to travel that far from your local area commander, or you're going to have to get your groceries delivered, by the sound of it. But it is 5 kilometres from home for shopping and exercise. A $5,000 on-the-spot fine for breaching self-isolation rules, a $5,000 on-the-spot fine for lying on a permit, a $5,000 on-the-spot fine for lying to a contact tracer, a $3,000 on-the-spot fine for breaching the 2-person outdoor exercise recreation rule, and a $3,000 on-the-spot fine for breaching rules around entry into regional New South Wales for authorised work, inspecting real estate and travelling to your second home. That permit system will come into being from midnight on Friday, so Saturday morning, and you'll be able to get that permit through Service New South Wales. But just repeating, if you haven't caught up with it, 466 new locally acquired cases, up from 390. And that was from a testing regime of 100 and, let me get the right number, 130,000 tests